What's going on, Home Health Success Academy viewers? Whether this is your first time watching some of our videos or, right, you're a return client, right? You're a return family. So over here at Home Health Success Academy, we help home health agencies, home care companies, hospice agencies, and other medical institutes out there learn marketing skills to increase revenue, to increase patient referrals, to increase their census. So today we're going to be talking about nurses and nurses that are causing your agency to lose clients. Now, I'm not just talking about just the nurses, okay? Because, I'm a nurse myself and I hate to put nurses always on blast. But we're going to talk about nurses, home care aides, your therapist, or even that person answering your phone call. So pretty much your employees that are causing your company to lose revenue, to lose referral sources, to lose patients. Okay, so we work on this idea, right, that we want to provide great care, right? But then we start mixing things up between great care and revenue. In the end, the biggest problem that we need to look at is we need to stop putting patients, all right, and clients as at putting them in a number situation, meaning that they're one patient, two patients, we have three people. You want to be able to know them as a person. Now, we need to really provide training to our staff members. I cannot stress that enough. Okay? We need to provide them and let them know what our idea about the company is. Let me ask you this. Can you honestly tell me your policy and procedure, if you under your policy and procedures, can you actually honestly tell me your vision, your mission, and your values without reading it? Let me ask that question. Do you know your mission, vision, and values? Countless times, I know agency owners and administrators, and it's okay. Look, I've done this in the past also. Okay? I know people who they had somebody else write that. They had a consultant write their mission, vision, and values. Why? Because it's needed for the application process to be able to get your license from your state, from Medicare, from JCO, or let's say you're just providing a home care company from, if you're the approval from your like, for example, if you're from Illinois, the Illinois Department of Public Health, to get these approvals. You need a mission and vision and values. But do you really understand that? And to be able to create the culture and to bring in your clients together, to be able for them to get the great service that they have, you must really create a custom mission, vision, and values and actually make sure that you implement that within your community, within your staff, that they understand that you do want to provide amazing services. You do want to make sure that all the clients are taken care of and that they're not just a number that you assign to them, right? And when we don't have that culture, we then eventually lose clients because our staff members are not having something to live by, okay? And that is the biggest problem. So let me ask this. Do you guys have that nurse that for some reason they turn in all their reports properly, they make sure things are documented correctly, right? But yet, a lot of patients don't like him or her, and it's causing you to lose a lot of referrals. You need to be able to look at that, and you need to be able to go back and look into patients that are lost. When you lose a patient, when a patient gets early discharged or decides to transfer to another agency, decides to transfer to another company, you want to be able to know what's the reason why the patient left. Not just, well, they wanted to be transferred. Well, there was a beneficiary transfer. No, you need to know why they transferred, right? So you need to have what they call a thank you team, someone who's in charge of calling these people, calling the patient's family, calling the physicians to find out, to first of all thank them, right? And don't ask them why are they leaving. Thank them. I just want to say that I want to thank you so much for allowing us to provide services for you. I know that you're going somewhere. Is there something that we can do to improve upon so that we can provide more care for you, right? Don't ask them, why are you leaving? Don't leave us. No, please don't go. That agency's bad. They're no good, right? Ask the client. Have that one-on-one session. You want to be able to have an open dialogue. So this is a reach out I have for a lot of the director of nursings out there, the administrators out there. When's the last time that you call one of your clients? When's the last time did you call one of your patients? Now, I know you're going to tell me that, I've called patients before. I've called, patients' families before. I've called referral sources before. But when was the last time, can you actually tell me, where you completely did it and you went beyond your duties? Making that quick phone call will only take a minute, will only take 2 minutes. I make it a habit for myself and for my team and for them to see how much I value our clients. When we get a referral, I will call personally the physician directly and appreciate and thank them for the referral. And if somebody from his team is the one that referred to us, I'll make sure I give her a call and say, I appreciate you for doing this. When we have a patient that we have admitted, I will call the patient myself, give them my information. I'll do the same thing for any immediate family members for that particular patient. I want them to know that there is a support team that's backing them up in the office, not just the nurse that they see 24/7. You want them to know that there's other people in your team that's there to help them. When people start seeing that, when family members start seeing that, more likely they will not leave. I've even seen it in the past where a patient's, one of our nurses, or even seen it before in other agencies as well, where their nurses were then convincing the patients to move to another agency. And that's sad. First of all, there's no loyalty with your nurse, and at the same time as the patient, they trust that particular nurse. So if they have that trust and that connection with that nurse, if that nurse leaves, they're going to want to go with them. So what you need to do is you need to create that big impact, that there is more to your agency than just that nurse providing care. There's you. When we have an admission in my previous home health agencies and my current ones, we do that. We call them. Patient gets discharged, we give them a call 5 days later after discharge. Is there anything bothering you? Is there anything that we missed? Is there anything that we need for you? And here's a wonderful technique. Well, every time you discharge someone, ask them this question: who else would you know would enjoy our services? Great referral question. Call the patient's family. So when I give you a report about your mom, this is what she's going to be having to do. And by the way, before, I know that you enjoyed our services. Who else would you know would value our great service such as this? And when they give you information, you can use that and market to that person and try to get their trust, right? When we market our company, we do not push them to try to give us a referral. We want to give them more value so that eventually they see that we are fun to be with, we are of value, and that they see that we really mean what we want to mean, that we want to provide great care, right? So stop letting your nurses or other people in the field, your CNAs, your therapists, cause your patients to leave your company. Right? So just wanted to be able to touch base with you guys and give you guys those quick tips and what things to avoid to, so that you don't create any additional problems for you guys. Best way to be able to avoid problems is to learn from people that face them and figured out solutions how to do that. That's my job here at Home Health Success Academy, is to help you guys succeed, help you guys to maintain your clients, to maintain that census, and to have that successful home health agency. Because remember, your agency is not just for you. It provides money and assistance to your staff members, right? And if you have a successful agency, you have a successful staff. And that is the main goal here. So I want to hear more questions from you guys. I'm kind of changing up my whole setup in my videos. I want to start asking you guys questions. What are you facing? What have you faced in the past with nurses that cause problems with your agency? Let me know. If there anything that I can help you guys, please go ahead and make a comment. Don't forget to subscribe in our videos. Don't forget to go ahead and like our videos as well. We want to be able to help you guys and push some information to you guys as much as possible, and be that person, that outlook that's going to provide care and provide you guys with ideas on how to improve your company and make it even better. So understand that home health marketing is not hard at all if you know what you're doing. And just to add to this, remember, look, you work so hard for these patients, for you to lose them because one of your nurses are bad. So honestly, get rid of them before they get rid of more of your patients. This is Michael Echeverria. You guys have a beautiful day.